So you can't get in to see a rheumatologist for many months. What should you do? Hello, this is Dr. Siddharth Damber, specialist in rheumatology and in regenerative medicine. A common problem that I hear from patients and that I see written all over the internet is that they've been referred to a rheumatologist, but they've been told that their next available appointment is many months out. 4 months, 6 months, 12 months, 18 months I've even heard. This is a real problem for a number of reasons. To begin with, if you have an active autoimmune condition, and if it's not treated and diagnosed efficiently and in time, you can have progressive disease that can then lead to permanent damage and a lot more pain and problems long term. So why do we have this problem? The American College of Rheumatology says that we're not creating enough new graduate rheumatologists from fellowship programs, and we have a lot more rheumatologists that are retiring. On top of that, we live in a country that is growing in size, and so there is a growing number of patients who have autoimmune conditions. So there's a significant imbalance right there. In addition, there are other structural issues. If you live in an urban area, you'll find a lot more rheumatologists. If you live in a rural area, there's really not a lot of newer rheumatologists that are setting up shop there. In addition, there is a little known secret in healthcare that a lot of healthcare institutions, whether you're talking about clinics, hospitals, multi-specialty groups, they're really bad at a lot of administrative tasks, including scheduling. And that may be their bigger problem than anything else. It doesn't really matter how busy you are as a professional. I'm very busy as a professional. When it comes to making room for new patients who are suffering, you have to make that room available. That has to be a priority. That is a failure in leadership in those kind of institutions if they're not making room for new patients in a more efficient manner. So what can you do about this? Number one, the most important thing I think, and this is something that physicians know about this, and I'm not going to gatekeep this from you, but you should ask your primary care doctor's office to make a phone call to the rheumatologist's office to see if they can help to expedite your appointment. It might not get expedited to the next week, but if you're not scheduled to be seen for 6 months, hopefully they can schedule it to within the next 1 month. Most physicians, in particular specialists, will go out of their way to help accommodate their colleagues, in particular their referring colleagues as well. And quite frankly, if your potential specialist is not willing to help out a colleague to see a patient earlier, maybe that's not the right kind of physician you want to be seeing anyway. Someone who does not have that kind of compassion and collegiality. Other things that you can do, however, before you've been seen and while you're waiting. Your primary care doctor, if there's concern that you have an autoimmune condition, can check the proper labs that need to be done. You can get that done before your appointment with the rheumatologist. In addition, if you have pains, you can get x-rays of the areas that are affected. Also, if you have a joint that is painful and swollen, ask your primary care doctor to order a musculoskeletal ultrasound. That ultrasound of that affected joint can show if there's significant fluid in the joint and inflammation as well. That is very helpful for the rheumatologist. And then lastly, also consider that there are rheumatologists that do telehealth or telemedicine appointments as well. This is really important. In a modern healthcare world, if you've had labs done, if you've had imaging done, you can see a physician via telehealth and help to get you on the path toward treatment and a diagnosis. In my own clinic in particular, if you go to our website, chicagoarthritis.com, and you need to be seen, you can make an appointment with us directly right through the website. Important because there's no reason to help delay your appointment, whether it's in person or through telehealth. And then lastly, what can you do while you're waiting for your appointment? What can you do from a treatment standpoint? To begin with, make sure you're taking the right supplements, omega-3, glucosamine, and curcumin that help with pain and inflammation. Next, if there's specific activities that are causing pain, adjust your activities so that you're more comfortable. Also consider working with physical therapy to help with pain, as well as to improve your functionality. And then lastly, also consider making appropriate anti-inflammatory dietary changes. The American College of Rheumatology recommends a Mediterranean-based diet in that regard as well. If you found this helpful, please give us a like, subscribe to the channel. Until we connect again, have a good day and live well. Bye-bye.